So which is better, MRI or a CT scan? Many people get confused, and even some providers get confused at times which test to order. And that's because the question is not really which one is better, but the question is which one is the most appropriate for a specific patient in a specific situation.
So CT is just a fancier and a better version of an X-ray. Okay, we don't really see much on X-rays, but on CTs we see everything. CT is very helpful for a brain head CT. It's very helpful for someone we're looking for an acute hemorrhage, an acute fracture. It's absolutely the indication of choice. And this is our MRI. It's better differentiation of the soft tissue and the bone. So it gives you far more detail. So it picks up that differentiation of the bone and the soft tissue much better.
So I referred a patient who just came in and who had months of PT but wasn't making progress. And she said, "What could chiropractic?" And I said, "Well, let's start with some imaging." And I remember Dr. Uppal said, "Yeah, let's take a look." She recommended some images based on the patient's findings. So we already were collaborating that we talk about. And unfortunately, this patient wasn't a candidate for chiropractic. They had a much more serious condition, but we knew that quickly. I was able to have a great conversation with Dr. Uppal, which then led me to a great conversation with the patient.
You know, this is great for me because as an acupuncturist, we get zero training in anything in the radiology field. So we get hopefully a nice printout that tells us exactly where the problems are, and then we can utilize that for our benefit.
I'm very excited because we're going to talk about the differences, we're going to talk about the benefits, the pros, the cons of each test, but also we're going to talk about the advancement in technology. And I'm sure that we're going to surprise some of you with the content today and with the information today. And why is that important? It's important because when you take the advanced diagnostic testing, combined with the interpretation, combined with the experience of the practitioner who is analyzing the diagnostic testing and then treating you, together, all that is the very shortcut to better health. And it matters. Better clinical outcomes faster is very, very important for all of us. So I'm super pumped, super excited. I'm here with our two amazing hosts, and you probably know both of them already. It's Ryan Diener, Holistic Health Associates in Frederick, Maryland. We also have Dr. Todd Johnsonbaugh, Dobbs Rehab Center in Columbia, Maryland. Dr. Todd, tell our viewers who is with us today and why everybody should be excited.
Oh my gosh, one amazing guest after another. And tonight we have Dr. Daisy Uppal, who is the president and CEO of Charter Radiology. And these facilities that she owns, operates, are fantastic and incredible. And she takes state-of-the-art technology and marries it with motherly care and compassion. I mean, what more can you want? And the epitomizing experience that I think of, Mike, is thank you for the introduction. I met Dr. Uppal just over a year ago, maybe a little less. And I was like, oh, wow, I was so impressed. So I referred a patient who just came in and who had months of PT, but wasn't making progress. And she said, "What could chiropractic?" And I said, "Well, let's start with some imaging." And I remember Dr. Uppal said, "Yeah, let's take a look." She recommended some images based on the patient's findings. So we already were collaborating that we talk about. And unfortunately, this patient wasn't a candidate for chiropractic. They had a much more serious condition, but we knew that quickly. I was able to have a great conversation with Dr. Uppal, which then led me to a great conversation with the patient. And they continue to come back and just thank me for actually taking the time to figure out what test it was and then facilitate communication. So that was, Dr. Uppal just epitomizes collaborating. And she's just not known in the medical field as a great medical educator, but chiropractors love her as well. And there's very few people that can bridge those gaps and bring those groups to better. So I think the goal, the mission of the group here is really well epitomized with our guest tonight. Ryan, I'll let you take it away with our first question, man.
Fantastic. Well, thanks again. Thanks, Dr. Uppal, for being here. This is great for me because as an acupuncturist, we get zero training in anything on the radiology field. So we get hopefully a nice printout that tells us exactly where the problems are, and then we can utilize that for our benefit. But as far as actual imaging goes, you are the expert, and so I'm thrilled to be here to learn something tonight. So I think the thing we should obviously start with is just kind of defining the difference between an MRI and a CT scan, and when you would use one versus the other just in general, and then we can maybe dig in a little bit from there.
So anyway, this is actually a CT scanner, but this is a very special CT scanner. As you know, this is a PET CT. That means you can do cancer imaging and regular CT. And this is our MRI here. And this is the, Siemens 3 Tesla Vida is the one that we have, is actually the best in the country. No longer just best in Maryland. This one is the best in the country. So what makes it the best? So first of all, the equipment is very different. This requires an RF room. It requires shielding, door closed. When Todd came here, he knows that I make sure that he doesn't walk in with anything metal, because this is actually a live magnet. This is strong. It has a gravitational field stronger than the gravitational field of the Earth. So it is very, very strong. It can pull, I always tell patients, it can pull all the cars in the 20 mile, radius. And the RF shield is what prevents it. So, but it has no radiation, okay? MRIs have no radiation. And how does it work? Very simply, it activates, it excites the water molecules in your body. And so we produce pretty images by exciting water molecules, very simply put, very brought it down to basic, 101 level. And this is a very fancy but very state-of-the-art X-ray machine. Okay, so that is the difference between the MRI and the X-ray. Whereas in an CT, you actually are getting radiation. So what is the difference between this CT? This is a 128 slice CT. So the higher the slices, the lower the radiation, right? That we forget that. We are not taught that. So on this scanner, this is the lowest radiation, and has sometimes, even when we did chest CTs, they were lower radiation than a chest X-ray. Can you believe that? That's how far the technology has come. And because after each patient, we actually measure the radiation dose. So the higher the slices, the lower the radiation, because the scanner works much faster and gives you, and also the detectors are very small and very tight. So very great resolution, but lower radiation.
Are the 128 slices pretty common now, or are they still pretty rare in the field, Doc?
Well, they're very expensive, so not everybody buys them. Right? This is a $2.8 million machine. By the way, please notice these UV lights in our new scanner. So they come out in the middle of the night and they actually disinfect our center. I think when Todd and everybody came, I actually showed it to them. So that's the difference. Okay, so
it's those extra steps, everyone. This is what we're talking about. This is when you're looking for providers. We talk about taking that extra step. Yeah. So you all saw that UV light that sanitizes the entire clinic.
I mean, that was really my idea, and my architectural team really took it to the next level. So you asked me, what is the difference? So I've really put a lot of effort into putting these teaching cases together on this YouTube site and made these playlists. So a lot of these are MRIs images, and you can see, we can take any one of these small videos and take a look at it. Now an MRI has a lot of soft tissue differentiation, okay? So remember that woman that you talked about, Todd, that she came in with hip pain?
Right.
And so we ordered an MRI because CT is really good if you're looking for an acute fracture, for a broken bone. So CT is just a fancier and a better version of an X-ray. Okay, we don't really see much on X-rays, but on CTs we see everything.
So I hope everyone hears that. We're looking for a lot of times with CT, mostly bone. Just to summarize real quick.
Yeah, and then as you can see now, this guy, he has metal, right? You can see that. So all our CTs and our MRIs have the additional, we are able to do metal suppression sequences, okay? So actually, I want you to see this case.
Dr. Uppal, can you explain to people who maybe have no idea, because we have
yes,
providers.
So I'm going to. So now look at this. This is a shoulder that has prosthesis, right? Did you see that? And if you put it back in the old magnets, did you see this patient? He has a shoulder prosthesis. Now, back in the old days, because it is iron, and if you put iron in a magnet, it will be all black, okay? And basically that MRI is useless. You see this? This metal prosthesis, but we now have the technology where we are able to suppress this prosthesis, and we can see around this prosthesis to help the shoulder surgeon to see what is going on. And actually this patient has a fluid collection and his prosthesis has failed. And we are able to see this. And this is only available like in the last few years, this technology. And it is getting better. So this one magnet that we have in Clarksville and the magnet that we have in Reisterstown, I mean, these images are absolutely gorgeous. This one was actually from our Reisterstown MRI.
So this is a great technology for somebody that's recently had a prosthetic, not a prosthetic, hip replacement or shoulder replacement, right? Do you see that for the majority of these?
Yes.
Or what else would you see? Shoulder, knee.
Here, shoulder, knee, and hip. So here's another hip that we did with metal suppression. So all, and you know, a lot of people now, you know, a lot of people are getting hips replaced. So actually this patient had bilateral infection in the prosthesis. So here's another case with, you know, metal prosthesis. And
Doc, can you show what it would look like with just the metal on there and then the suppression one more time so people can image that? Do you have that?
I can just actually stop it and then just paste through this image very slowly where you can actually see that. So that white is all fluid and infection around the prosthesis. Do you see it? This is all infection. And this black is the prosthesis. So this patient actually had so much infection. And if they went to a regular other MRI that didn't have this, they wouldn't be able to see it.
Do you have one where what a normal MRI would look like with this case or no?
Yes, my goodness. That's what I wanted to show you, this playlist that I've put so much material.
How many videos do you have here? And this is just for the good public to just learn more, right, Doc?
Yeah, so I've got you so many cases here, you know, that you can really learn. That's why I wanted to just show this to you, that I've got a whole series of hip images, shoulder images, TMJs, you name it, and we are now creating this for you.
You know, I know it sounds kind of hokey, but was there a particular experience in your life that made you this passionate about educating? Because, you know, like we were talking, you're doing this out of the kindness of your heart. I mean, this is just a great public service. Was there a particular experience you can share with?
I don't know.
You were always like this.
I was always like this.
Oh man.
Even when I was teaching at Hopkins, my residents used to love me. And actually, some of the residents are still on my Facebook. They write, I mean, I just have a passion for teaching.
Yeah.
Dr. Uppal, can you tell us, so like, you know, clearly the MRIs are going to be more focused on soft tissue injuries, and the, you know, CT scan is going to be more looking at bone injuries
here's your
and
answer to
cancers, right?
the-
So,
Here's
so
your CT. So here's a fracture of the left greater trochanter. And then on our scanner, this is actually someone with prosthesis, actually, since we can do metal. Do you see that fracture? Did I go by it too fast?
No,
we saw
yeah,
it.
perfect.
You see it?
Let's do it
Now-
one more time for everybody to see that.
Now, if this scan was done on a regular CT that didn't have that metal suppression, they would not be able to see this fracture.
So let me ask you a question. Why, one of the things that's really frustrating as a provider is when you know that the patient has a soft tissue injury, or you know that they have something that they need a PET scan or a CT scan for, and they have to get an X-ray first before they can go do this. Why is that the case? And why do we keep running into that?
I think that's what, and then look at these 3D images that we do on our 3D workstation. You know what, Ryan, that's such a great question. I think that's what's going to make me quit medicine very soon is insurances and this constant pre-authorization. And if they keep on at this rate, I promise you, I will quit and go live in Australia or something. Because every pre-authorization says they must have an X-ray, okay? So let's say I know if my kid fell playing soccer, I can tell you both my kids, so my older one went to Gilman and he played 3 sports. At Gilman, it's mandatory. They have to play 3 sports, as you know. Okay, so he played tennis, water polo, and what else did he play? Swimming. So he tore his hamstring, he fractured everything. Okay, he was a guy. Okay, my younger one had played sports, and I can tell you, between the two of them, you know, they are enough to, you know, just give me a lot of business by themselves. Okay, and if it's my kid, I want my kid tears an ACL and I hear a pop on the lacrosse field, I want them on the table right now, okay? Because right now they've got acute edema, and that's our promise to orthopedic surgeons is that we're gonna bring your child and we're gonna image them same day, okay? ACL tear on the field, our promise was to orthopedic surgeons that we will image your athlete same day, okay? Now they want people to go have an X-ray, then they want physical therapy. So that means by the time they come to us, that edema is long gone. You're lucky I can barely say where the injury was. It's because I'm a good radiologist. I say, oh, you know, there was a fracture here because, you know, there's no edema there anymore to help me. I mean, it's really sad what's happening with this whole insurance industry.
And that negatively affects the outcomes. And
very
that actually
badly.
takes the patient
It
longer
makes-
to heal.
Yeah,
So
it's
yeah,
gonna make- it
we
makes
should
it
have a
double-
Mike. We need to have another one on just on that.
Yeah,
Oh,
I mean,
can't
I'm
tell you.
telling you, that's what it makes radiologists miss stuff. It makes us, because look, each of our MRI scans generates like 1,600 images, okay? That's a lot of images for each one of us to look at. And if you don't have all these secondary signs to help you to find the injury, I mean, you're really, it's a nightmare.
So if it was up to you and you had your choice, a patient comes in, they had an injury,
There would be no X-ray.
no X-ray, and you would go, and how would you determine MRI versus CT?
So if you you know, most people have seen a provider, right? And you know that if someone was playing lacrosse and I mean, I some of the orthopedic surgeons may disagree. They would say I would want an X-ray first. Okay, they can get their X-ray first, and then I would want to immediately do an MRI. Unless, of course, it's broken bones. You know what I mean? It's broken bones, yes. Yeah, you know, it's broken bones. Someone's got a tibia, fibula fracture. Someone's got a comminuted fracture. It's trauma, multiple bones fractured. Yes, then we have to do CT, no doubt, because that's what's, you know, multiple broken bones. That's where CT, that's the role of CT, is broken bones, shoulder fracture, humerus fracture, wrist fracture, radius ulnar fracture. That's where CT comes in.
So at this point, you think X-ray could just be eliminated altogether?
I'm not saying that totally eliminated. There is a role for it because in tumor cases, I still look for an X-ray. I get the X-ray because I correlated with tumor, because I want to see if there is any soft tissue, if there's a lytic lesion. So you can't say really eliminate it, but what the insurance industry is basically doing is they're saying, oh, if you've not had an X-ray, you can't have an MRI.
And I wanted to also mention in the same context, maybe slightly different example, but let's say you go to an urgent care facility because there is abdominal pain. The standard recommendation, my understanding, is that they always start with a CT scan, even though we are looking at a soft tissue, not at a broken bone. And then, and only then, when the provider, the specialist, gives you the recommendation and the referral for an MRI, only then the MRI is going to be done after the CT scan. But do we really need to go that route and have all the radiation if the MRI is the test of choice?
No, CT is the test of choice for abdominal pain.
So that would be appropriate. Okay.
Yeah, because you're looking for appendicitis, you're looking for free air, you're looking for obstruction. So when there is diffuse abdominal pain, really CT is the test of choice. And so the urgent care providers are absolutely right when they order a CT of the abdomen pelvis.
Got it. Thank you. Thank you. That's important to know. And that's why I want that video to be viewed by different people. For some people, certain things are obvious. For some providers, they're obvious. But for people watching, if they hear, for example, yes, CT is more for bones when we are looking for fracture.
Yeah, and I may have some examples here of these are a lot of these cases are COVID cases that we have been doing for the last 1 year. And actually, we also just joined the American College of Radiology database, where we put all our COVID database into the ACR national database. So we too joined the rest of the radiology, imaging centers across the country. So actually, I think I have some CTs as well. Maybe I'm more biased towards MR. So I do need, but I thought I did have some CTs in here on which I show acute, because I love CT as a modality. CT as a modality is amazing. I wanted to see if I have any appendicitis here or any ruptured colon. I guess I haven't added that yet. So, but yes, we have numerous cases of that. I can even pull them right off my packs, but they have the patient's name on it. So these are all anonymized, so I can show you that, but I can't show you those. Those do not have, those still have patient database on it.
So Dr. Uppal, could you give us, maybe if somebody is watching and they have no idea about the basic stuff that you may consider very obvious, if you could give us maybe 3 bullet points on pros and cons of a CT scan, and then pros and cons of an MRI.
So CT is very helpful, like you said, for abdominal pain. CT is very helpful for a brain head CT. It's very helpful for someone we're looking for an acute hemorrhage, an acute fracture. It's absolutely the indication of choice. CT is very helpful in the chest, if we're looking for a pneumothorax, and also in the indication of acute trauma. Acute trauma, you want to do a CT of the chest, abdomen, pelvis, head, so and extremities. So CT is absolutely the modality of choice.
And is that because of this? Is that because of the speed of the scan, or because of something in the image itself?
Both speed and also because it's very good for bone injury and the soft tissue injury. So it'll show you all of that.
Mm.
And then let's switch to MRI. If you could.
MRI is obviously it's better differentiation of the soft tissue and the bone. So it gives you far more detail. and it takes much longer. Our scanners are getting faster, but an MRI will take you good 25 minutes to image, even with the fastest scanner. And it gives you far more, for example, like I just showed you this one, or a brain. Let's go back to a brain. So here's a hip fracture, and you see how much edema. So it picks up that differentiation of the bone and the soft tissue much better. So
One of the issues some of our patients have, and it's amazing how, you talk about, yes, we want this image because it's great. And they go, I don't care. I do not want to go into a tube. So if you don't want to go into.
So yes, that's always a challenge. I have many patients who suffer from claustrophobia. And before, I was not very honest, but I am probably the most claustrophobic person on this planet. So I actually share that journey when my patients come here who suffer from claustrophobia. So I actually tell them that I myself am very claustrophobic, and I actually help them through it because, first of all, the Siemens MRI machine is 20 centimeters wider than the GE MRI. Okay, so it's a lot more roomier. So it makes it less claustrophobic.
And I wanted to also add that this is extremely valuable to have somebody who is open to collaboration on the diagnostic side, because I know a lot of doctors and practitioners who collaborate with you, Dr. Uppal, and I know that they really appreciate the speed of communication and the fact that you are open to give them your opinion and your advice. And this is so important because when we talk about collaboration for the best clinical outcomes, sometimes two people and even two experienced people look at the same scan, but on 2 different days and from two different perspectives. And then maybe you're going to be able to see something that is just a shortcut to better health for a patient. So I want to compliment you. And for all providers who are watching from Maryland or internationally almost, they can always look for providers like Dr. Uppal or even ask Dr. Uppal a question, because that collaboration and communication combined with experience, that's actually something that is very meaningful for our patients. We had a conversation with Dr. Todd without giving too much specifics. Dr. Todd is one of the providers who really appreciates the speed of communication. And why? Is because he cares about his patients, and together it's so much better to get them better. So really thank you for being who you are in terms of not only a very skilled provider, but also being so open to networking and collaborating with others. Very important.
Well, I really love that because, I learned from that too. So it's a learning experience for me as well. And I really think for patient care, it's really great because like that happened with the first time I met Dr. Todd. He sent me that patient and she had hip pain and actually turned out to be much worse than we both thought. And I thank God I had his number. I called him and I, communicated instantly with him, and he was amazing. He actually went to her house. He talked to her and he said, I'm going to be the one who's going to deliver the diagnosis to her because I have a relationship with her. So he actually drove to her house and, delivered the news. And it was handled so compassionately, so well. It was handled, instead of her reading her report or or not finding out, she had the best of care because, he delivered it personally. I don't know anyone else. There are very few providers out there who will actually drive to patients' homes. I do know a few others who will do that, but there are very few of us left out there who still believe in that. But like I said, it's a journey for me as well. I get to meet great physicians. In my journey in the last 7 years since I've opened Charter, I can tell you, I have been privileged to meet amazing patients and really amazing referring physicians that I've really, got to collaborate with. So it doesn't just happen one way. It's really is a two-way street.
We all appreciate. I want everybody to not only hear what Dr. Uppal said, but also feel it. We talk about important things. We talk about the differences between diagnostic tests. We talk about the technical aspects. We talk about all the things that are important, but they are more of a mathematical formula for the outcome. There is also the human factor that I want everybody to pay attention to and pay very close attention to, because some people have a wrong picture of a provider or a doctor. They may think that the doctor is that super successful person who is on the other side of the table who will just write a script. And this is a fraction of the doctors, for sure not in our network. In our network, we really get people who care. I saw Dr. Uppal's post about a very young patient, and maybe you can talk about it, talking about compassionate care. I want everybody to know this, that behind those names of different offices and names of doctors and all the letters after their names, there is also big hearts along with skills that are here to help you. I find that great pride being part of a network like this. So Dr. Uppal, talk about that post about the child and the story that you mentioned in the post.
I'm so glad my son is not connected with me on Facebook, because they get very angry with me, because if I write anything about them, they get very upset at me. They're like, why did you write about us? But it's true. I was, during this COVID time, I felt this last 1 year that it was a very stressful year, because I got to take care of very sick people. And I also got to take care of a lot of healthcare workers. So all those COVID CTs that you see, and some of those healthcare workers didn't make it, and I knew a lot of them. So my very first healthcare worker that I took care of was a personal friend, and we lost him. So it's not easy. And the last year has not been easy on me, and everybody knows that it's been probably one of the hardest years. Taking care of very sick people. I mean, I've always taken care of sick people, but this COVID year is extremely difficult, because you're taking care of a disease that was out of nowhere, and it affected a lot of healthcare workers. And where do healthcare workers come? A lot of them come to Charter, so it was hard. So I felt very stressed, and I felt that I was kind of losing some of my memories. So I have my iPad. Actually, I lost my iPad, and it has had all my my kids' pictures, from the time they were born till now. So I was actually very upset. Many people tried to find that iPad again, and I could not recover that iPad. So, but they bought me a new iPad, and of course they were able to recover. My IT team was able to recover all my photos. And my son says, "Mom, do you understand? You have 3 terabytes of photos. You take a lot of photos."
Sounds like a proper mom.
I said, "Well, I'm a radiologist. I take a lot of images. All these photos. It's a lot of MRI images." So, and he was, and I looked at a lot of those memories, of my kids, and I had this child in my MRI machine, and when I walked in, he was 6 years old, and my staff was there, and he had to be injected, and he was really skinny child, very skinny child. Mike, even skinnier than you.
No, that's impossible.
So, and I looked down, and I needed to inject him. And so I asked him, I said, "Can I inject?" And he's like, "Yes." And so I told him, I said, "When my son was your age, he had to be injected at Howard County General." And I said, he wouldn't let my technologist inject him. So my older son, he had fever, and I was a radiologist at Howard County General. So I took him there, and he had meningeal signs, so they had to do a spinal tap, but they wanted to do an MRI of the brain before they would do a tap on him. So I put him in the MRI, and I was standing right there, and we had to inject him, and he wouldn't let my technologist inject. He said only my mom can inject me. So I remember, of course, I got the IV. And so I wrote that post saying, you know, you would only trust your mom, but this 6-year-old today, he had faith in your mom, and he let me inject. But that's something that comes with being a mom, right? That I have that compassion, because I've been through this experience with, and raising my own kids. I remember when patients come up to me, and their kids would have ACL tears, their moms would say, oh my God, this is the end of the life. And I would tell them, I said, no, I have 2 boys, they've had multiple injuries, and then they have gone on to play. You'll be fine. Just talking to them. So it just doesn't end with, most people think radiologists just sit in the dark and they just read a film. But I guess I'm unique in the way that I actually do talk to my patients, not only sometimes patients, but patients' families.
Yeah, that post that you wrote, it was about compassionate care and that aspect of being a healthcare provider. And I think it's ultra important because the people who visit you, especially if they don't just visit you on a follow-up, but there is a major stress in the whole family, and they come to see you knowing that you not only are there to help with the technical aspects, but you also understand what they're going through. That part is something that people don't talk about too much, and they don't. I mean, it looks the same. There's a facility, there's an MRI. It may be better, maybe worse, but it looks similar. But I want people to really pay attention, because if they visit the right provider, they will have that provider, just like Dr. Todd was, so involved in that situation that he couldn't just send an email or have a phone call. The same goes when it comes to analysis of diagnostics. I remember your phone call when you called me when we had a question, and it was a phone call I didn't even expect, and you said, hey, I'm looking at this is what I'm seeing. I mean, who does that? The person who actually cares. And I want to compliment you on this one more time, because this is what healthcare should be about, is the going an extra mile, because that extra 25 minutes you spend, or even 10 minutes you spend on something, can be the differentiating factor between finding that diagnosis or missing it. And it's so easy to close the laptop and say it's 8 p.m. I'm done. Or for some people 5 p.m. I guess. But you know what I mean. So I really appreciate that all our providers here are truly involved in patient care beyond the technical aspects, but also they have their heart in it.
So we started today's evening like very serious and scholarly, and we ended like all like kind of tearing up there. Oh my goodness, I didn't expect that to happen.
I guess that's awesome. And yes, to close up strong, I think the very important part is to understand, we were talking about the subject is, which one is better, right? So CT scan or an MRI, is it really one or the other? So sometimes I think the key is for people to understand that it's not up to them to decide as a patient, but it's up to the provider. I may think, just because I had this much knowledge about this, that maybe MRI is better in that case. And as I just talked to Dr. Uppal, no, CT scan was the appropriate course of action in that situation. And that's perfect. So we need to trust the providers. We need to also know what are the differences between those tests. So correct me if I'm wrong, but I understand CT much faster. So it wins in time. It loses on radiation because MRI has no radiation. MRI wins when it comes to soft tissue detail visualization, right?
Yes.
But the CT scan is, you mentioned something about the level of details because of the speed of the machine. So which one is more detailed when it comes to that?
Well, they're both now becoming such great and complementary modalities. Sometimes we end up doing both. We start with CT and we end up with MR, and we end up doing both. So, we use both modalities.
So that's an interesting conclusion. That
And
sometimes
now
you may think-
we're starting off with CT, we do MR, and then we do PET CT for cancer, right? So, in some cases you don't need it. Like for appendicitis, we do CT, we send them to the operating room, and they get operated on, and then it's over. But sometimes to define a certain thing, sometimes we have to use more than one modality.
Understood. I think that's a very good conclusion for people to know. We need to try first, go to the right providers, right? So
Correct.
know something about your provider, but then trust the provider's advice. And sometimes it's not as simple as like which one is better, because it depends, just like at the beginning we talked about it, it depends on what's better for a specific situation and for a specific patient. Because if you're claustrophobic and maybe you just can't spend 25 to 40 minutes in a tube, then maybe we'll be looking at a CAT scan. But if you're pregnant, I don't know.
Or if you have a pacemaker, you cannot go into an MRI. And then the CT is your only choice.
So good to know. So that would be our conclusion. If you have any specific questions, ask Dr. Uppal. She's very active on social media, which surprises all of us because she's ultra busy and she still responds to comments. So ask questions below. I definitely encourage you to collaborate with all the providers in our network, specifically with our guests when it comes to diagnostic testing. And just know that if you are part of a collaborative approach network, it's just so much easier, because whether you're a patient and an individual looking for clinical solutions, you have people who can team up to help you. But if you're a provider, you can team up with others to just make your process of getting your patients better easier. So reach out if you need any support. We wish all of you a very good night, and a big, big, big thank you to everybody here that you see on the screen. Ryan, Dr. Todd, and most importantly today, Dr. Uppal.
Thank you so much for having us. Bye.